Hi, everyone. I'm Dr. Smadar Kort. I'm the Director of Non-Invasive Cardiac Imaging in the VAF Center at Stony Brook Heart Institute. I'm happy to be with you on Go Red for Women Day. Go Red for Women Day is a national initiative by the American Heart Association in order to stop heart disease and stroke in women. I have with me a great panel of experts, which I will introduce to you now, starting with Dr. Bloom. Michelle, if you can say something about yourself.
Sure. So my name is Dr. Michelle Bloom. I am proud to be and honored to be part of this spectacular panel today with my colleagues. I am a heart failure cardiologist. I direct the Outpatient Heart Failure and Cardiomyopathy Center at Stony Brook, and I also co-direct the cardio-oncology program there. So thank you for having me.
Dr. Noel Mann.
Is Dr. Noel Mann. I'm one of the non-invasive cardiologists here at Stony Brook. I'm also the director of the Cardiology Fellowship Training Program, co-director of the Women's Heart Center, and director of Cardio-Obstetrics. And it's really a pleasure to be here with all of my colleagues here today.
Dr. Alison McClarty.
Hi, everybody. I'm Alison McClarty, and I'm a cardiothoracic surgeon here at Stony Brook. I head the Mechanical Circulatory Support Division here, which supports patients in the very end stages of heart failure. And I'm very glad to be part of this panel addressing this critically important problem of heart disease in women. So looking forward to speaking with you all.
Dr. Lira Tam.
Hi, everybody. It's an honor and pleasure to be here today with all of you, as well as all these wonderful colleagues. I'm an advanced heart failure and transplant cardiologist. I'm also the associate medical director for the LVAD program here at Stony Brook. I'm looking forward to having a lively discussion with all of you today.
And last but not least, Dr. Laura Wolf.
Hi, everybody. I'm Dr. Laura Wolf. I'm with North Suffolk Cardiology, one of the community practices in the area. I love to specialize in heart disease in women, especially heart disease in pregnancy. And I'm very honored to be part of this panel here today.
Thank you all for joining me today. So cardiovascular disease, which is a fancy name for disease of the heart and the blood vessels, is still the leading cause of death for women in the United States, claiming the lives of approximately 1 in 3 women. Despite that, the majority of women are not aware of the risks that cause heart disease and really how to prevent it. We believe that knowledge is power, so we're here to empower you by giving you some knowledge as well as some practical tips on how to improve your heart health. The title of today's program is Heart Health for Women at Every Age. So we will talk about how you can improve your heart health at every stage of your life. During our discussion, please submit your questions in the comment section below, and we're going to do the best to answer all of them. The first point that I want to discuss is when in our lives is the optimal time to start investing in our heart health. Dr. Mann, what are your thoughts?
Well, it's definitely never too early to start and never too late to start. So I think really from day one, even in your 20s and 30s, it's important to think about the future. We know that buildup of plaque in the blood vessels begins in your late teens to early 20s. So eating healthy, avoiding foods that are high in saturated fats, processed foods, exercising regularly, and making that a habit in your life, as well as managing your weight and the consequences of that over time. And I, look at it as kind of putting money in a piggy bank. Everything that you do good for yourself, whether it's exercise, eating healthy, managing your weight, and managing any risk factors that you have, like high blood pressure, high cholesterol, or diabetes, is putting pennies in the piggy bank. Smoking, eating junk food, not exercising is taking pennies out of the piggy bank. And especially for women, smoking is really one of the most detrimental things you can do for yourself. And on average, women that smoke live about 14 years less than women that don't smoke. So if you smoke, please stop. If you don't exercise yet, please, try and start. Even if, we recommend, we'll get to that a little bit later, but even if you start slowly, 5 minutes a day and work yourself up, it's better than doing nothing.
I agree with you that we should really start as early as possible. And we should probably start even during our childhood. Dr. Wolf, you're a mother of young children. What tips can you share with us on how to encourage heart healthy habits in our children?
I think the most important thing that we started to talk about already is that the time is now. Regardless of what stage of your life you're in, whether it be in young adulthood, or beyond. In regards to our family and our kids, I think the best thing that we can do is make it commonplace, make healthy habits the rule and not the exception. That the healthy snacks and the daily activities are things that you do without even thinking about it. And that it's not a struggle to get them to eat, the healthy vegetables and fruits and be healthy lifestyle and active. But it's something that they find as normal and not something that's the exception to the rule.
Dr. McClarty, any tips for the teenage years?
Yes, so I agree with everything that's said, and I just want to reinforce what's been said, because there have been, unfortunately, autopsy studies looking at children even younger than their teens, at the age of about 9, 10, 11. And some of these studies have shown that children of that age, especially if they are obese, when the autopsy is done, it shows that plaque buildup has already begun in their hearts. So just to reemphasize the point that it is absolutely never too young to imbue our kids with healthy eating and exercise habits. And in terms of teenagers, having raised 2 of them myself, I can tell you that if you tell them what to do, but you don't model it yourself, your words fall on deaf ears. So I think modeling for our young people the healthy habits that we believe in is critically important. And if we do it, it rebounds to our credit, but it also models for them an excellent example of good health.
I agree. It's really difficult to expect our kids to eat vegetables once they see us eating burger and fries in front of them. Totally agreed. When I'm thinking about my 20s and 30s, there are clearly some key advantages for that young age. Dr. Bloom, how can women take advantage of those advantages and use them to build healthy foundations?
Yeah, so the 20s and 30s, I think, are really an ideal time to set up your life plan, if you will, because it's obviously a very busy time in any woman's life in her 20s and 30s, obviously, depending on what you're doing. You're starting your career, you're starting your families. But on the other hand, you have more energy than you'll probably ever have the rest of your life. Obviously need to try and carve out some time for yourself, some time to start healthy exercise habits, time to, carve out mental health, abilities for yourself and things like that. I think that especially because that's sort of the childbearing years and that's premenopausal, this is the time in a woman's life where her heart health is its best. So I almost feel like this is the time to capitalize on what you plan to do to keep your heart healthy in your later years.
Yes, totally agree. But even at that young age, when everything seems to be just perfect, this is the time to start keeping an eye on family history and start assessing our own risk. Dr. Tam, what specific family history is important for young women to be familiar with? And also, what blood tests should be done in the 20s and 30s? And what else needs to be assessed during an annual visit?
Yeah, I just wanted to add a little bit to what Michelle was saying, that, talking about the 20s and 30s is an important reproductive age for women. So to keep in mind that a lot of women will become pregnant during this time period. So, we all know that gestational diabetes, gestational hypertension, eclampsia, preeclampsia, preterm labor have shown an increased incidence of cardiovascular disease for women later in life. So it's important to also pay attention to that stage of a woman's life in their 20s and 30s. In addition, this is the time to go see your doctor and start talking about prevention. It is important to get your blood pressure checked, at least in one of your visits. We also advise women to get their lipid panel check, which is your cholesterol. We do advise that diabetes screening is also done in this age group, 20s to 30s. It's important that we'll talk about these risk factors that could be genetic, but also just part of the diet and the culture that the patients have.
So, Dr. Tam, you mentioned gestational diabetes and eclampsia. Those are problems that develop during pregnancy. Some women have heart disease that started before pregnancy, but they became apparent only during the pregnancy. And in some women, they know about their heart disease and they need experts to manage them. At Stony Brook, we have a dedicated center in which obstetricians and cardiologists work together to monitor and treat all these women. Dr. Mann, can you tell us about the cardiobstetrics program at Stony Brook?
Yes, I'm the director of the cardio-obstetrics program here. Basically, we see women in pregnancy or peripartum that have either disorders of pregnancy like preeclampsia or hypertension in pregnancy, or have congenital heart disease. So, all of these conditions actually predispose you to worse outcomes in pregnancy. Additionally, having hypertension in pregnancy predicts hypertension later in life. It increases your risk of having a heart attack later in life. Gestational diabetes as well puts you at a 56% higher risk of having a heart attack later in life, and a 4 times higher risk of having diabetes later in life. So if you have any of these conditions, it's really important to follow up with your physician and make sure that all of those risk factors are managed postpartum. Additionally, we see patients that have disorders of the aorta, which is the large blood vessel that comes out of the heart. And there's some other risk factors that women may be more susceptible to, including systemic disorders of inflammatory disorders like rheumatoid arthritis or lupus. Those also put you at increased risk of heart disease later in life. Having premature menopause is a significant increased risk for coronary disease. And all of the traditional risk factors also tend to affect women more than men. And, I guess we will get to that a little bit later, but women in general have worse outcomes when they've had a heart attack or any cardiac event, sometimes because of delay in diagnosis, but also because more often women are diagnosed a little bit later in life. We have that protection from estrogen early in life.
Speaking about later in life, Dr. Wolf, what would you recommend women do in their 40s and 50s to stay heart healthy?
Well, I think one of the most important things is what we touched upon, that we need adequate follow-up, right? All too often, I have so many patients in my practice that are in their 40s and 50s that tell me, I feel great, nothing is wrong. I can't tell that I have high blood pressure, or, my mom had a heart attack, but I think I'm fine. Prevention is the key. And the earlier that we can get them to see us and see their primary care physicians and really be on the road to making sure that everything that we can and will foresee be managed, whether that be with medical therapy or with the appropriate lifestyle and dietary changes. I think that the earlier we can do that, the better, and the better outcomes that we're going to see for our patients. So really getting the appropriate screening early on in life, in your 30s, 40s, 50s, and really paying attention to those risk factors, like Dr. Mann was just alluding to, is key.
Dr. Bloom, what do you recommend women do in their 60s and beyond 60s?
So people say those are, I guess, approaching the golden years. So you have almost the opposite of your 20s and 30s. Probably you have more time. Your kids are grown out of the house. You're empty nesters. So you have more time to invest in yourself, and you should, because as we mentioned earlier, it's never too late to start. So even if you're not a person who had invested time before, or you didn't have the time to invest before, I think the 60s or the 70s or whatever decade of life you're ready to start, you should start. So it's really, really, really important to check with your physician, either your internist or a cardiologist, if you haven't started an exercise program already, just to make sure that everything is okay and that you let that person guide you as to, what is an appropriate amount of exercise and type of exercise. It's really important to have your blood pressure regularly checked. Remember, these are the postmenopausal years, so we know estrogen is protective. And once our estrogen levels drop, we have an increased risk of bad cholesterol going up, good cholesterol going down, and an increased risk of cardiovascular events like heart attack or stroke or heart failure. So you want to really be mindful of your numbers, know your blood pressure, know your cholesterol levels, know your waist circumference and things like that. So all of that being said, you really need to speak with your doctor and kind of make a plan with your doctor going forward. But I think it's, again, never too late to start, and really important time to sort of get your numbers into check.
You mentioned having more time to exercise. You're also going to have more time to sleep. And I really cannot wait to get there to catch up with my sleep, which we also know that is really important in preventing heart problems. Heart disease in women is somewhat different than that in men. Dr. McClarty, as a surgeon who actually gets to look at people's hearts, can you tell us how women's hearts look and function differently than men's hearts?
So, in general, women are smaller than men. And so when they come to the operating room, they are often technically more challenging just because one is working on a smaller sized heart. So when one is doing bypass surgery, for example, for blocked arteries, a woman's heart bypass is often technically much more challenging than a man's, based purely on size alone. Add to that as we've heard, estrogen is protective. So women who come to us with coronary artery disease are usually older, often in their 60s or their 70s, and the older one is, often the frailer one is. And so when we operate on our older female patients, all surgeons immediately know to take extra care because the heart is a little more friable, a little bit more delicate, and certainly smaller. So structurally, the heart is different. In terms of how women present with their heart disease, there are also differences, and I'm sure we'll elaborate on this a little bit more, but women often present with their ischemic heart disease differently from men. We've seen TV shows where a classic heart attack is crushing chest pain, raining down an arm, and that sort of thing. That's typical. Women, unfortunately, can have atypical symptoms. So almost 50% of women, when they're presenting with their heart attack or with their angina, their symptoms may be more subtle and not clearly what one might be expecting. So things like heartburn, being sweaty or diaphoretic, in some cases an intense fatigue. These very, very vague symptoms can sometimes herald ischemic heart disease or an impending heart attack, or a heart attack, as a result of which women will often dismiss the symptoms and delay seeking medical attention. So what we see often, unfortunately, is that our female patients come to us later. And I've had so many patients come for heart surgery days after they have completed their heart attack. And now they have weakened heart muscle and are much more prone to heart failure. So that's why something like this educational thing that we're doing is critically important, so that women can learn about their hearts, be in touch with what they might be feeling and their symptoms, so that they can seek medical attention in a timely manner.
I cannot emphasize enough how important it is to be evaluated right away if there's any suspicion that you may be having a heart attack. You may need to call 911 and get to the closest emergency room. At Stony Brook, we have an accredited chest pain center that is specialized in primary PCI, which is the procedure that we do when we take someone emergently to the catheterization laboratory and we open an occluded blood vessel, typically with a stent. We got a question from Jenilyn about cardiac arrest. Dr. Mann, what can cause cardiac arrest? How is that different than heart attack? How deadly it is, and can it be prevented?
So it all depends, again, on the cause of the cardiac arrest. So there's different reasons you can have a cardiac arrest. A heart attack is obviously the one we all know best. But there can also be primary arrhythmia reasons for having a cardiac arrest, or even pulmonary reasons, stopping breathing, to cause a cardiac arrest. If it is from coronary disease or having a heart attack, then the best thing to do is always, in the case of someone that you witness a cardiac arrest, if there's a defibrillator nearby, to get that defibrillator close to the, onto the patient as quickly as possible. If there's any suspicion of a heart attack, then the patient should come to the closest emergency room and be evaluated, preferably in a center like ours at Stony Brook, where we're able to do primary angioplasty, and if it is a heart attack, open that artery. The reason people have a cardiac arrest when they're having a heart attack is if the blood vessel gets blocked, and then the blood flow to the heart is not adequate, and that in itself can cause an arrhythmia, and that's what leads to cardiac arrest. If it's a primary arrhythmic cause, there are certain congenital electrical kind of reasons that you can have that, and sometimes they occur without warning, but sometimes that occurs in families, and is usually there may be a history of that. But it's, I saw the question on Facebook, and unless you know sort of the reason for having it, there's no specific test that you can do to say, will you have a cardiac arrest? But there's also some other congenital abnormalities of the heart that predispose you to having a cardiac arrest, such as hypertrophic cardiomyopathy as well, which is diagnosed by an echocardiogram.
We discussed before different risk factors for development of heart disease. One risk factor that people typically don't think about is having a history of cancer and receiving chemotherapy or radiation to the chest. We actually did get one question about that as well. These people who received chemotherapy or radiation or both can benefit from an evaluation done at the cardio-oncology center. Dr. Bloom, can you tell us about our cardio-oncology program and how you can help these women?
Absolutely. So at Stony Brook in 2015, myself, Dr. Kort, and one of our breast cancer oncologists actually founded the first cardio-oncology program in Long Island. And we've been really, really successful at recruiting patients, not only from within Stony Brook, but also from some of the private groups and some of the other neighboring cancer centers. We've seen thousands of women and men, really any patients who either are about to undergo cancer therapy like chemotherapy or radiation, or lots of patients who, for example, had cancer when they were children or teenagers, who we know are then at an increased risk of developing heart issues earlier in their life than their contemporaries. We see all of those patients. We have a comprehensive way of evaluating those patients, including seeing those patients in the office with myself and my nurse practitioners and some of our other heart failure doctors, and also offering those patients very, very intensive imaging, echocardiograms, sometimes cardiac MRIs, whatever we feel like is appropriate to evaluate that patient. What we spend a lot of time doing, especially if we're catching patients early before chemotherapy or radiation, is to really help patients understand what their risk factors are for the development of heart disease going into the cancer therapy. And then we follow those patients very closely. And I always say to patients when I meet them the first time, it's going to be the start of a long relationship, but a good relationship, because we are able to prevent a lot of detrimental effects to the heart by seeing those patients early and often.
You mentioned cardiac imaging, and cardiac imaging is very important for evaluation of patients who either have known heart disease or suspected of having heart disease. The most common imaging test that is being used is an echocardiogram, which is an ultrasound of the heart. Where you get your test is very important. The Echo Lab at Stony Brook has been triple accredited and reaccredited in all possible tests performed by a cardiac ultrasound. We're the only one in Suffolk County, one of only 7 such echo labs on Long Island, and one of only 42 in the entire state of New York that have this triple accreditation. So obviously we're very proud of our achievements. And typically accreditation is associated with high quality of both the equipment that is being used as well as the people that work in that facility. So like I said, we're very proud of our achievements. We talked about different risk factors for heart disease. Dr. Tam, can you go over some of the numbers that are important for us to know?
Yes, so the risk factors for heart disease are things like hypertension, diabetes, obesity. So we always talk about this as things that we want to modify early on. So for example, for women, we know that a waist circumference over 35 inches is linked with higher cardiovascular disease and adverse events. So we recommend that you keep that under check. And the other thing is BMI, which is the body mass index. This is something we look at, and we say that an average BMI to kind of keep in mind is to be somewhere between 18.75% to 23. Other things are blood pressure. You know, hypertension affects women a lot more than men, meaning that women with hypertension have worse cardiovascular events than men do. The same goes along for diabetes, as Dr. Mann mentioned earlier. So it's important that you pay attention to your blood pressure. Like Dr. Bloom said, know your number. Normal blood pressure should be something 120 over 80 or less. So we strive to have that for our patient population. You know, most of the diabetic patients need to also have tight blood pressure control, because that adds an additional risk factor to that. Women tend to develop diabetes in comparison to men a lot earlier in life. So by the 20s and 30s, women are already having more diabetes than men have. And as they progress into the middle age, men tend to get diabetes then a lot more than women. Then by later on in life, diabetes is equal between men and women. But what we know is that women with diabetes have a 50-fold increased risk of cardiovascular events in comparison to men. And part of this could be because women are living with diabetes a lot longer than men are. The same thing goes with hypertension. So I can't stress it enough. These are risk factors we need to modify early on to avoid having hypertension, diabetes, by controlling our diet, exercising regularly. I always advise my women in clinic to exercise at least 30 minutes daily. And if they can't do it daily, to at least do it 3 times a week. But if you strive to have a routine that you do it every day, you're likely to be successful.
You're nice. I'm pushing for 5 days a week. So 3 days can be done, can definitely be achieved. We have a question from Susan about palpitations. Dr. Wolf, do you want to explain what palpitations are, what we should be worried about when we hear palpitations, and what kind of test you can offer patients?
Yeah, of course. So palpitations are incredibly common. All palpitation is the ability to feel your heart beat. There are all different things that can be associated with that palpitations. More commonly than not, palpitations are very benign, meaning that they're not going to cause of much consequence. Us as women tend to feel our palpitations very regularly when our hormones are in flux. I have a lot of patients in my practice that are in that perimenopausal, menopausal age, that palpitations are a very big nuisance in their lives. More commonly, what we need to do is figure out why you're having the palpitations, and is it a truly benign heart rhythm, or is it something more that we need to do more investigating work about? The first line thing that we should do is do some sort of monitoring. Any type of abnormal heart rhythm can be exceedingly difficult to diagnose unless you're wearing a monitor at the moment in time that you're experiencing it. So many patients that I've seen say, well, I was just in here 2 months ago and all my testing looked normal. How come I'm having these palpitations intermittently? Well, unless we have a monitor on you at the moment in time that you're having them, there's no way to be 100% sure what exactly is going on. So a heart monitor, whether it be a 24 or 48-hour one, or one that it can last even up to a month, might be indicated. The other indication would be to get an echocardiogram, which is, as Dr. Kort was saying before, it's a structural evaluation of the heart muscle. Very simple procedure, no risk associated with it at all, to make sure that the heart muscle in and of itself is functioning normal. There's no significant valvular disease that can be causing these extra heartbeats. And then we need to really examine the patient for all of their risk factors. So are they at risk for heart disease in terms of ischemic heart disease that we need to further flush out? Are there family history? Do they have autoimmune conditions, which is a very prevalent thing that I think gets under-recognized? Did they have preeclampsia or gestational diabetes earlier in life, and now they're in their 40s and 50s, and we need to really make sure that they're not a hypertensive heart disease patient that has gone undiagnosed for years. I think that the first thing that when you have palpitations is come see one of us and have that conversation to really make sure all of your risks are managed and have any further diagnostic testing that's indicated.
We got a very specific question from a 75-year-old woman who had cryoablation done about 15 years ago, and she was doing really well all these years, and now she starts having symptoms again. Dr. Tam, what would you recommend her to do at this point?
So at this point, I would say it's time to see your doctor again. If you haven't followed up, this is time to get back and get a check. Having an ablation does not preclude the chance of having it again. So you could, again, be having the arrhythmia that you may have had prior. So it is time to go get tested, see your physician, where they may consider doing a Holter monitor or a more prolonged monitor, as it was mentioned earlier, for arrhythmias. And also, importantly, they may do additional studies. So I would say call your doctor, and we are more than welcome to see you at our arrhythmia center here at Stony Brook to discuss this further and investigate it further.
I would also add that if you can get records, granted it was 15 years ago, but if you don't have records yourself, if you can call the place where you had your cryoablation done, if they can send you the information, that would be helpful. My guess is that it was atrial fibrillation that was ablated because it is the most common arrhythmia, which abnormal heart rhythm that we see. But we do ablate other abnormal rhythms as well. So if you can get the records and bring that to your physician, that would be helpful. Susan also asked about cardiac plaque. Dr. Mann, can you talk a little bit about calcium score, and when do you send patients to get calcium score?
So calcium scoring is a CT scan of your chest without contrast, where we look for any calcium in the coronary arteries or the arteries that supply the heart. It's really indicated in patients where you may be on the fence about treating them or not treating them for their cholesterol. So in general, when patients come to the office, we look at their cholesterol profile. And we actually have a risk calculator that we use that inputs their age, their blood pressure, whether you've smoked at all, and then all of the parameters of the lipid panel. And if your risk is above 7.5%, meaning that risk of, it's actually a 10-year risk of having any cardiac event, is more than 7.5%, then we recommend that you be on a medication to control your, or to lower your cholesterol, like one of the statins. And if your risk is below 5%, then we would recommend managing your risk factors with diet, exercise, etc. If you're in between the 5 to 7.5%, and you may have a strong family history, or you smoke or have other risk factors that aren't included in that risk calculator, like having kidney disease or having some type of systemic inflammatory disease like rheumatoid arthritis or lupus, then we might use a CT with calcium scoring to look for any calcium in the arteries that supply the heart. If we see any calcium in the arteries that supply the heart, then you really want to be very aggressive about managing risk factors. So if that's the case, then I would recommend to my patients that they start a cholesterol lowering medication. If I saw calcium in my coronaries, I would want to be on one. But we really want to get that bad cholesterol, which is the LDL, in your lipid panel, down to less than 70. And your blood pressure, again, very important to control that. You want that to be ideally less than 120 over 80. And weight. And if you are overweight, losing weight can help you lower your blood pressure. And I always tell my patients, losing weight is a really good blood pressure pill. So if you're overweight and your blood pressure is, mildly elevated, oftentimes lowering your weight will improve your blood pressure, and oftentimes also improve your, if you have an abnormality in, or you're pre-diabetic, it will improve your sugars as well. So if you have, especially weight around the middle of your body, around your abdomen, that also puts you at higher risk for coronary disease. So really want to be aggressive with those patients. And the one other thing I always emphasize to my patients as well is exercise. So we always think of exercise as being good for you, which it is. It's definitely good for you, but not exercising is bad for you. And not exercising is a risk equivalent to same, risk of heart disease almost as smoking a pack a day. So it's really, really important if you're not exercising and not moving to start moving, because that is an independent risk factor for developing heart disease by being sedentary.
If I could add as well, the component of diet and salt restriction, just the heart cardiologist in me needs to talk about this. So I think it's important that, especially if you have hypertension, that exercise, salt restriction is also important, and the weight reduction. We don't know why, but women do respond a lot better than men to losing weight and controlling their blood pressure. So we'll take that as a pro and just get it done. The other thing to be important to pay attention to is the type of diet you have. The Mediterranean diet is a great diet to follow for hypertensive people. We do say the DASH diet is excellent. But again, focus on a diet that's rich in green leafy vegetables, so vegetable-rich diet with fish at least twice a week. And if you have to have additional proteins, stick to the lean proteins such as chicken and turkey. I highly advise that the diet becomes an important lifestyle modification as well.
Yeah, I agree completely.
Yeah, and the Mediterranean diet is also rich in nuts, and in addition to the fruits and the vegetables that you mentioned, and berries. Berries are great for you. They're really high in antioxidants, and those would be good to eat. And if you lose weight, like was mentioned before, you can control your blood pressure, or at least improve on your blood pressure, your glucose level, but also your cholesterol level and your triglycerides. So it's important when you lose weight to really stick to the right diet, not just lose weight, but really start developing good eating habits that would really last a lifetime. Monica is asking if a baseline stress test should be done on patients or people. Shouldn't really say patients, but a woman or a man that are over the age of 60 and have no other risk factors. So I would tell you that I would have not done a routine stress test on someone that has no risk factors, but I would encourage that person to exercise and tell me if they do feel any shortness of breath, any chest pain when they exercise. There is really no reason to perform a stress test on someone that really has no risk factors, no family history. Obviously, if on an exam we find something, we hear a murmur, there is any abnormality that we want to further investigate, then we can get an echocardiogram, look at the structure of the heart, and in some instances, we do like to see how the heart actually performs during stress test. But without any finding on physical exam and no other risk factors, we typically don't do just a routine stress test. Like I said, I would send you to the gym or walk outside and get your exercise that way. We also have a question, and Dr. Blue, maybe you can help us with that one. This is a question by Chrissy, and she is asking, at what ages should the average asymptomatic woman and man being seen by a cardiologist?
Yeah, so that's a hard question to answer only because I don't know that there's actually a right answer to this. I think
that's why I refer it to you.
Of course. So I actually think it's never the wrong thing to do. Listen, if you're worried about your heart and you don't feel like you're getting enough answers from your other doctors, I can tell you personally, for me, I don't mind seeing people that don't have any symptoms. I'm happy to kind of go through all of the risk factor profiles and, talk about heart health. I'm very passionate about all of these, things that we can do to, prevent heart disease. Very, very, I think we're all very passionate about that as female cardiologists in general. So I don't think that there's an age cutoff where if you're younger than a certain age or older than a certain age, you should or you shouldn't see a cardiologist. I think if you're worried or you really just want more information that you feel like you're not getting from your other doctors, then by all means, make an appointment with one of us. I'm sure every single one of us would be happy to see you anytime.
And Michelle, I just wanted to add to your comment that if you have a family history of early coronary artery disease, such as males in the ages of 50 or younger, or females ages 65 or younger, or a family history of sudden death, things like that also should be incorporated. So if you have that, for sure, do seek care sooner than later.
We talked about the most important risk factors. We talked about the importance of stopping smoking, modifying our diet to a healthy diet, exercising. I think that we did not talk enough about stress. Dr. McClarty, maybe you want to talk a little bit more about stress, how that contributes to heart disease, and what we can do to improve the level of stress in our lives.
Yeah, that's tricky because life is stressful and has been more so for everybody, frankly, these last couple of years. But clearly, we know that stress and emotional issues, stress and depression, anxiety, these have been shown to increase the risk of heart disease. So now that we are aware that these things have a real measurable impact on our heart function and our heart disease, then it behooves us to take tangible steps to try to fix that. So I think trying to build into our lifestyle times and ways to sort of bring it down and de-stress or make choices that limit stress in our life, I think that is how we begin. And I think it's hard. It's interesting that you asked me that question because my life honestly is nothing but stress most of the time. But I have found it mandatory to take time, even if it's stealing time in a day, to just stop and reflect, or brief periods of meditation. I mean, for some people, it is it's their faith. For others, they de-stress with exercise. They de-stress with bonding with people, with families, and so on. I think whatever it is that works for you, I think it's really important to acknowledge that it is essential as taking a pill or stopping smoking or anything. It's essential to address the stress, address the emotional negatives, again, like depression or severe anxiety, because they do have a tangible effect on heart disease.
And can I just add, I agree completely with Allison, of course, but I think women, even more so than men, feel this enormous burden to take care of everyone around them. I always tell my patients, I obviously take care of a lot of women, we're taking care of our spouses, we're taking care of our aging parents, our growing children, our friends, our colleagues, and we oftentimes forget to take care of ourselves.
Our dogs also, right?
Yes, and our dogs.
It's
just incredibly important. You have to just remember that if you can't take care of yourself and you're not taking care of your own emotional and your emotional well-being and your stress level, then you're no good to anyone else, and you're going to increase your risk of having some type of health issue. So it is so, so important to remember that as women.
And yeah, Michelle, just to echo that, I think it's so important that a lot of our female patients need to hear that they're allowed to take a break, that they're allowed to have 5-10 minutes to themselves in an hour or two in a day to really decompress, to give themselves some free time to just do whatever that makes them happy. And they have to hear that that's okay. And whether that's exercise or meditation or all the things that Dr. McClarty mentioned, that it's something that they enjoy to do. And it's okay to have that time to really decompress. And that's so important for their cardiovascular health overall.
So it's okay to learn how to say no, and basically say, no, I'm not available right now. I'm too busy taking care of myself for the next 5 minutes. So on that note, I would like to hear from each one of you what you do personally to protect your heart. And I would say that Dr. Blue Michelle is my Peloton buddy. So whenever I see her smiling face, I take the same class. So she really motivates me to exercise more and perform better. So Michelle, maybe you want to start and giving us some more tips. Maybe I can learn more.
So I actually have to say, I was actually going to say the same thing, that Dr. Kort and I have a Peloton bond. But I will say, and I think it's important for everybody on here to hear, I actually didn't always routinely exercise my whole life. When I was in my 20s and 30s, I was so busy in med school and with babies and all of that, that I actually was very bad at prioritizing my own health. And it took many years for me to realize that that needed to be an important component of my life. And now I actually don't miss a day of exercising, doing something active. And if it's not my Peloton, it's playing tennis, or it's doing some yoga or Pilates or whatever it is for 20 to 30 minutes a day, I make sure that's a priority, even on my busiest days, and even on the days that I don't feel like doing anything. Because I just think it's so important to do that. So I just think everybody needs to give themselves a little solace, and it's never too late to start.
Dr. Mann, I was always impressed with you getting up early in the morning. I'm not a morning person, so I actually exercise late at night, but that's what works for me. Are you still able to wake up really early in the morning and continue to exercise?
I do. I did this morning. Yeah, that's, to me, it's very important that I do that every day. I feel like you also have to practice what you preach. But for me, actually, when I'm in bed and my alarm goes off and I really want to hit the snooze button, I always remind myself that I feel better after I exercise. So I always take my my gym stuff out, my leggings and, all my stuff out. It's ready to go in the morning. So all I have to do is just kind of throw everything on. But you have to sort of make that time for yourself. And for me, I have 3 sons, 2 are in college now, but, exercising in the afternoon or in the evening things were too busy, that really wasn't an option for me. So now I, made it a habit of getting up early and doing that before work. And to me, it's actually, that's sort of my stress reliever. I feel, to me, it helps me get some of that stress out. But it always makes me feel better throughout the day when you exercise. And, even that 30 minutes less of sleep, I feel like it gives you more energy during the day when you do it. I'm also, I'm very careful about what I eat. I'm careful about my weight, but it's something that you have to keep, a close eye on. I make myself my lunch every day. I'm careful about that. But it takes work. It actually takes a lot of time to do that. So, I know for some people it's difficult to do that. But I really try and emphasize to my patients, try and, do that. Try and make your own lunch and bring your own lunch and not go to the cafeteria or whatever it is that you work, or go to a fast food place because, it's 2 seconds to do that. It really is an investment in yourself. That's how you have to kind of see it. And again, it's those little pennies in the piggy bank. You try and do what you can. I'm like Michelle, I exercise almost every single day.
And you can develop some ways to make things a little bit easier and more efficiently. You can cook on the weekend, you can freeze food, you can chop up some vegetables and have them ready for you to create salads on a daily basis. So there are ways, especially for really busy women, to try to help and still maintain good eating habits. Dr. McClarty, any additional tips for us?
Yeah, I think this exercise thing can be what you make it. So, for example, I'm not good at a gym, and I don't unfortunately have the discipline for Peloton, which is an excellent form of exercise, but I really enjoy ballroom dancing, for example. And so when I do ballroom dancing, I'm physically active, I'm with friends, the music's great, and I'm moving. And so you can pick an activity that is exercise but is also fun. My daughter also has recently gotten into rock climbing. So I've been rock climbing with her, and that's also different set of muscles, but really good exercise and also a good social activity. So, if the idea of being on a treadmill or riding a bike doesn't do it for you, there are a lot of fun things that you can do that make you physically active and, put you in a good mood as well. And the final thing I would say in terms of eating, because unfortunately I'm a real softie for sugar. I like cake, I like cookies. And so now that my kids are out of the house, I just don't buy that stuff anymore. So when I come home late at night and I'm exhausted, and what I really want to do is crash in front of the television and eat junk, I can't because I don't have any. And so I find it helpful to try to help myself by not surrounding myself with temptation.
So you're trying to avoid the seafood diet. You see the food and then you want to eat it. So if we don't see, then better chance of not eating it. So I would say that the pandemic actually helped with some options and choices of exercise. And those of us who don't feel comfortable going to a gym, there's so many ways to stream classes and exercise at the comfort of your own home, or be outside in the outdoor and exercise there. There's so many different options now for exercise, and exercise is not necessarily just lifting weights or being on a treadmill, but there's so many other different options, and some of them are really fun. I started to play pickleball actually a couple of years ago, and I really like that, and I can definitely relate to you, Alison, with the dancing. It's a great way to socialize with people and also move and be active. So anything that you do, and it's the best exercise is the one that you're going to be doing. That's the bottom line. So find the one that works for you and do that and have fun during the process.
And I just wanted to add one thing. So, we definitely emphasize cardiovascular exercise, so anything, kind of movement. But another thing that is really important, especially after age 40, is doing some type of weight or resistance training. So if you don't do weight or resistance training after age 40, even if you do cardiovascular exercise, you'll lose muscle tone. So it's really, really important to incorporate some type of weight or resistance training into your exercise regimen. So whether that's, lifting weights, doing bands, it can be body weight exercises like doing lunges, squats, sit-ups, push-ups, those all count. Doing yoga, Pilates, Tai Chi, that counts as resistance exercise as well. So just, really important. And I really recommend this to my older patients, really above 60. It's very, very important that you do this. You don't have to do it every day, but even if you do it a few times a week, it really helps you maintain your muscle tone.
And there are some things that you can even do while you're sitting down, or better than sitting down, if you can get like a standing desk and get some of your work done while you're standing. And as you do that, you can do some squats. People don't see you when you stand at your desk and get work done. So take advantage of that and use that to exercise as well.
So I just wanted to add something in regards to exercise. So as a mother of really little people, so I have a 4-month-old, a 5-year-old, and a 7-year-old. So I love to exercise. However, I want all the mothers out there to really hear this, that it's okay to give yourself a break. It's okay to take that hour to yourself, that the babies will all be fine. They'll still be there when you're done. And for me, it's easier for me to get out of the house to exercise at the gym. But however you make it work is great. And the other really important thing to hear is that if you have a crazy busy day and the infant is just having colic, or the big one has a lot of homework, and you can't make it work that day, don't give up. The next day will be better. And it will continue to get into a more consistent routine going forward. And you're going to have good days and you're going to have awful days. The important thing is that you don't give up on yourself and you try again the next day to resume the routine as best possible.
And
Dr.
I'd like
you're
to
the only one we didn't hear from yet. So
Sorry, you said me, right?
yes, you. I'm curious to know what you're doing.
What my routine is. So I always hated running and aerobic exercises, but then I became a cardiologist and realized that was very important to do. So in order to do something that's aerobic exercise, I invested on an elliptical rather than a treadmill, and I find that very a lot easier for me to do. So I like to do about 30 to 45 minutes on the elliptical, and there is different training activity levels you could do, sort of modifier intensity level. And I try to modify that throughout the week. I love strength training. So for me, that is something I always add in additional to my aerobic exercises. I also have a 15-month-old at home. So some days are tougher than others, but just like Dr. Wolf said, if you can't do it one day, don't give up. You could always do it the next day and the day after that. It's important that we do prioritize our health as well, because if we're not healthy, we can't be around for our children.
So our time is actually up. It's incredible how quickly this hour passed. I would like to thank you for joining us today. We hope that our conversation helped you to understand what you could do and how you can protect your heart health at different stages in your life. You should start taking care of your heart health obviously as early as possible, but like we said before, it's never too late to start and develop healthy habits. If you're not sure where to start and how to start, ask your healthcare provider about your own risk and how it can be lowered. And if you don't have a provider, we would love to see you at Stony Brook Heart Institute and help optimize your own heart health. And by the way, keeping your heart healthy will keep the rest of your body healthy, because some of the tips and some of the things that we talked about today can also help preventing other diseases as well. So with that, happy Heart Month to all of you.